So welcome to your NFL kickoff day. And as I just said, my name is Suzanne Rowden, and I'm a family physician, but I tried to expand my practice to make sure that I really took care of people at the entire primary care level. And what I found was that true family medicine is using a lot of diagnosis and giving you disease labels, and what I wanted to do was to continue to make people well and bring those labels away as much as possible, and that's how I got into holistic medicine. I'm going to be walking a lot over here today because the computer, I have to actually hit it. The clicker's not working today. So what I wanted to start off was to try to give you an idea. These are new terms to a lot of people. Most people don't understand the differences, and what I find is that we just need to clarify what a typical MD, or even in these days most DOs, practice is what we call allopathic medicine. There's actually a term for that, allopathic medicine. And what I'd like to get you to understand is that particular medicine, what you've probably grown up using and understanding, is something called biomedicine. So we do a lot of biochemical treatment. We talk about this molecule and that molecule and how it must be blocked, or how you're deficient, or how you must get more of it, and how you change pathways based on that. And so that's a very typical type of, here, take the pill, that will cure you level of medicine. What I'd like to say, in my experience about allopathic medicine, is that in our day-to-day training, we as physicians have slowly learned more and more technological stuff and forgotten more than we'll ever know. So, for example, in today's day and age, you'll all be told to go take omega-3. And you have to have this much, and it has to be these many types of molecules, and you must go get it at this particular pharmacy, when your great-grandmother probably just took cod liver oil forever. And we forgot about cod liver oil for about 40 years. And now we're back saying, oh yeah, you know, by the way, that was actually a good thing, and you should be taking that. So it's things like that, that in medical school I never learned, and you have to go back and look at tradition and look at what we knew, whether it was folk medicine or family medicine, and don't forget what did work. So the next thing I wanted to do was talk to you about the new trends, the new names that you might see or hear, so you can try to understand what's out there. There are different specialties that usually are run by primary care people, whether it's internal medicine or family medicine or even pediatricians, sometimes specialists. The terms that you'll see are integrative medicine and functional medicine. They have a little bit different specialty in and of their own. They have their own colleges, and integrative medicine really utilizes some of the other traditions, but has sort of taken it to a next step to treat even very severe illness, such as cancer and that sort of thing. And they tend to try to integrate what we do know from other specialties, but still keep it under the medical roof. Functional medicine is, again, a new level of training. And when I say to you new level of training, what I mean is, for example, a family physician can go on and become specialized in, say, sports medicine. And there is a college of sports medicine that you have to train under and study and take tests with. There is now the same in integrative medicine and functional medicine. Functional medicine is similar to integrative medicine, but they're very concentrating on trying to look at the underlying cause to illness, and they will work with you to try to figure out from the bottom up how this occurred and what you can do to fix it. And then there is the term alternative medicine, and even the National Institutes of Health has a center for alternative medicine. And what we mean by that is people who truly have a specialty and training outside of allopathic medicine. So it's not an MD or a DO, it's others. And then the last term is holistic medicine. And this is probably the most nebulous. Some people just call themselves holistic practitioners, but there really is a definition of holistic medicine, and I'll try to get you to understand that. There's no rule, anybody can use the term, but there is a classic way of defining yourself as a holistic provider. So the first thing I wanted to do was go a little bit over alternative medicines, maybe what falls under that category, and I'm hoping that maybe you've heard of some of these, things like acupuncture, and today I'm going to speak about homeopathy, chiropractic, Reiki, hypnotherapy, naturopathy. As you can see, the list goes on. Some of these are thousands of years old, such as Ayurvedic medicine, herbal medicine, acupuncture. Some are hundreds of years old, such as homeopathy. It's 500 years old. All of these degrees actually have specialty training in colleges of their own, outside of allopathic medicine, and require degrees to practice. That is the difference. Okay, they are specialists and they actually have their own training and they are professionals. Holistic medicine means that you are a medical physician, allopathic physician, who then has training and practices one of these. I actually have training in acupuncture, homeopathy, and hypnotherapy. And homeopathy is the one I want to speak to you about today because I think it's the one that you can use in your house every single day, and you can learn it and you can utilize it and you can make your family well for it. I use this with my children every week. My daughter just got 2 homeopathics this morning because she has some eczema flaring, and I will not put steroids on her. So again, you can utilize all of these, and they all have their purpose. They all have their own traditions, and they all have reasons for working. And what I say to people is, why would you choose one of these specialties? Why would you choose to go there? And if you think about it carefully, there's usually multiple reasons. One might be that there is no effective cure in allopathic medicine, that we actually don't have an answer for this particular issue that you're going through. The other might be that it maybe isn't clinically safe to utilize an allopathic treatment. For example, if you were pregnant. So in pregnancy, we really try to minimize the chemicals that we're putting in because they can pass through to the baby. And so maybe there's a safer alternative in this regimen for that. For example, chiropractic is a great one, and massage therapy during pregnancy. And then the other thing is that maybe the allopathic treatment has a severe side effect in you, and so you're not tolerating it. That might be a reason to do it. And then finally, many people tend to turn this way when the allopathic treatment starts to become so complicated with so many different remedies that their pill list gets so long that these can alleviate some of those medications for whatever the condition might be. So that may be multiple reasons why you would choose to use one of them. So I wanted to share with you my story of how I sort of really pushed my boundaries into holistic medicine. I was fortunate. I was in the military for many years and a physician in the military. And I have to say that, believe it or not, because all they care about is their people getting well, and it's not about making money, it's about actually utilizing services and using less money, they were very open to using some of these alternative medicines. And while I was in the military, I was fully trained and practiced in hypnotherapy, and I was trained in acupuncture and actually opened the first acupuncture clinic at my hospital. But my story gets really big after that. My daughter, who's now 12, at age 7, had a very unfortunate infection with Giardia, and we did not know it. She was not symptomatic, she wasn't having stomach problems, and she got a routine vaccine. And because of the double hit on her immune system, she got a very serious condition in the immune system called Henoch-Schönlein purpura. It can be life-threatening, and it can have lifelong illness to your kidneys. Your immune system starts to attack yourself. And my daughter suffered horribly for this, screaming in pain, hospital visits, more than 20 in over 2 years, hospitalizations, steroid treatments, almost surgery. It went on. And in the first 6 months of that treatment, I spent more time in a hospital than I did in my training. And I slept less, and my family was stressed, and I was trying to still care for my patients, and my younger daughter was completely isolated because her mother was constantly in the hospital with her older sister, and it was a very stressful time on my family. And I knew the condition, I knew what it entailed, and I knew that there was no answer. And of course, I spent night after night on the internet and calling my colleagues, because I was an academic physician at that time, I was a professor, and so calling the best professors in the country, Johns Hopkins, UCLA, USC, personally getting to talk with them on the phone. There was no answer for my daughter. And can you imagine as a physician how frustrated I was? So we know that Henoch-Schönlein purpura burns itself out. Your body has to cure itself. And it usually lasts about 6 months. 6 months came and went, and my daughter was now Cushingoid with side effects from the steroids. Steroids are only used in rare cases in this condition, but hers was the only one where you had to give the steroids. And so every time she kept going down, it was abdominal pain, and she couldn't eat, and she would vomit, and the only thing that ever settled it was steroids. And so I still have pictures of my daughter with a big blown up face at 7 years old. It was not fun. Finally, at 6 months, we decided that we would really try working on her diet to get her to just eat right and help calm her immune system down. And we did a multitude of things to just do what you know you're supposed to do to help your daughter be well and not have an answer. And so at 1 year, they told us, don't worry, this never lasts longer than 2 years. At this point, my daughter was in hospital school. She missed so much school. A year into it, I said to my husband, she seems to be getting better. These seem to be spacing out, but there must be more that we can do. And so we just really looked again at diet and maybe some supplements and tried to get some help there, and nothing. 2 years later, the longest ever of a case of Henoch-Schönlein purpura, my daughter was still having horrific outbreaks. Of course, a doctor's child does the worst of anybody. So I finally decided that I was in a situation where I had some colleagues who knew homeopaths, and I'd heard a lot about homeopathy, and my one colleague had utilized it quite a bit in his office. And I asked him if there was somebody that I might be able to take my daughter to. 3 months later, my daughter's condition was gone. 3 months. And I don't believe it went away on its own. I really do not. And I looked at what this homeopath did, and I said to my husband, he has all these little wonderful white pills in his office, and supposedly every one of them has a different purpose, and there were hundreds, and I want to learn how to play with those toys. And so we talked a lot, and he decided to allow me to go back to school for 2 years, and I studied homeopathy, which is a 4-year degree. And I learned more in 2 years. It has helped me and my family and my patients on a daily basis. And there are actual homeopaths in this country, and in some states they're even paid for by your insurance, such as Oregon and I believe Minnesota and Florida. And there actually are schools of homeopathy here, and homeopathy is actually written into the medical laws here, that the National Handbook of Homeopathic Remedies can never be gotten rid of. It's the one thing that we will be able to maintain in our history, but we can't let the practitioners get away, if I have anything to do with it. So that's my story. And basically what I wanted to do was to share with you how this works and what homeopathy actually is, because it is not biochemical medicine. What I learned when I went to homeopathy school was to look at the body in how it's trying to show us that it changed, how it went from health, and what were the underlying things, and what you can help a person identify are the things that we call the total load that made their body actually shift, that made their health shift. Whereas in medical school, I was told to do that, but I really spent a lot of time looking at the symptoms, giving it a diagnosis, and then just treating it, versus trying to figure out the path toward the change. And I really love that. So what I wanted to stop doing was giving patients titles and giving them lifelong issues that insurance companies would then look at and say, you've had this, for the rest of your life, you're at risk for it. I wanted to bring them back to the wellness. And what I find for patients is once they're given a title, they spend a lot of time sort of feeling like they have to prove that they earned that title. They have to prove that they're sick constantly, whether it's to insurance or to their work or to their disability agent. And what I wanted to start doing was actually saying, forget about it. It's time to just get well and get rid of the title or the diagnosis. So as I said, I believe that homeopathy is used every single day and in many households, but what I want to do is give you some tools about it. And I want to change your thinking from what is biochemical medicine to what really is energy medicine. So Energy medicine, what does that mean? How do we flow? And I wanted to try to give you some examples of what I mean that you probably are aware of. So again, a lot of the alternative medicine lists that you saw, they work on an energy medicine principle. So what do you know in regular allopathic medicine that works like that? So number one, an EMG. Has anybody in the room ever had an EMG? Yes? So they put these little needles in you, right? And they can read literally the flow of energy through muscle and through nerve endings and see if there's blockage, can't they? Well, what is acupuncture? It's actually reading the same thing, but using it to heal. And that has nothing to do with a pill and nothing to do with a pathway, but the body can tell a lot based on just the energy that is naturally flowing through its own. Another example of that is an EKG. Has anybody here ever had an EKG? Okay. What is an EKG? They literally, all the way at your fingers and your toes, hook you up to a machine that can tell exactly how the electrical current is going through your heart. Exactly. All the way out here. How does that happen? That's energy. That has nothing to do with a sodium channel or a calcium channel or a magnesium channel or any other blockage. That's energy. The same thing with MRIs. MRIs, it's not an X-ray, it's not a chemical going through you. They throw energy at your body. Every electron around your atom gets shifted. And when it comes back, that electron releases a pocket of energy. And to an MRI machine, they read that as a shade of gray. And you can literally tell the difference between a diseased gallbladder and a healthy gallbladder based on that shade of gray and the energy, the amount of energy the gallbladder is actually able to give back. Biomeridian machines can measure that same amount of energy and tell you where it's wrong without a $1,000 machine trying to make the reading for you. And it can pick up that same energy, illness or wellness, from the same type of energy evaluation. So I bring to you that we're already practicing energy medicine, it's just that we're not sometimes open to it because some of the age-old practices, we didn't understand that physics back when they were operating, they just knew that they worked. Or I think it may be a little bit like the pyramids, they knew more and we've forgotten more than we ever knew, right? Okay, so what is homeopathy? Homeopathy says it has a theory and a philosophy that like cures like. And I'm going to bring it really down to simpleness, okay? We are all made from the earth. We get minerals, we get vitamins from what we eat, just like a plant, just like an animal. And we are all made from maybe salt or iodine or molybdenum or selenium or lithium or what, but every cell has a different need. The idea is that each one of us has a distant cousin. So maybe we're more like salt, or maybe we're more like a daisy, or maybe we're more like a maple tree, but that we each have our own unique chemical makeup, but that there would be something in nature that would be quite close to what's going on. And then how does it work? People don't get, what they do is take in nature, oh, that's interesting, take that thing from nature and crush it down and then dilute it and dilute it and dilute it and dilute it instead of taking a chemical higher and higher doses. For example, blood pressure medicine. We start you on a low dose, and if that doesn't work, we give you more, and if that doesn't work, we give you more. Well, homeopathy actually says that the more we activate and dilute it, the more powerful yet gentle. And the theory is that it goes past Avogadro's number, and this gets complicated. But the theory is that it can't do harm because essentially there's so little there that you can't have a big chemical reaction. And I have lived that in my life. It is almost impossible to have an adverse reaction to a homeopathic medicine, which is lovely. So what does that act like? What are the things that you already know that work just like homeopathy? Number one, homeopathic remedy we use every day, sublingual nitroglycerin. They take nitroglycerin down to 0.4%, spray it under a tongue, it dilutes right into the bloodstream and immediately can stop a heart attack. How does that happen? It's an extremely small dose of medicine. And because it's under the tongue and dilutes there and doesn't have to go through the gastric, doesn't have to go through mucosa, doesn't have to be converted to the liver, doesn't have to right into the bloodstream, effective. I have seen it, unfortunately, literally stop a heart attack in my office. What's another example? Allergy immunotherapy. If we have a child who's allergic to grass, we take grass, we crush it up, we dilute it down to very minuscule amounts, tiny infinitesimal amounts, and then inject into them exactly what they're allergic to. Like cures like. We inject the grass into them, their body starts to learn not to have the same reaction. The body knows how to actually adjust its reaction. And homeopathy works a lot like that. Another example is snake venom. There is no chemical, there is absolutely nothing in the world that can stop a reaction to snake venom except snake venom. Homeopathy is exactly the same thing. If you have a poison ivy allergic reaction, the antidote homeopathically is the poison ivy plant. Crushed down, put it under your tongue, stops poison ivy like that. And it's available over the counter right here, no prednisone, no antihistamines. I use it every day in my office. It's a wonderful tool, homeopathy. So what I wanted to do, and I do have some handouts that I've left on the table there. I just don't want to walk over and get them, but it has a list of homeopathic remedies for you to take away today that I use every single day in my home, every day. Apis is the #1 homeopathic remedy for bee stings. Works like a charm. Any bite that swells and is itchy, I don't even care if it's mosquito bite, put that under your tongue, it'll get rid of it in a minute. And it even comes as a cream. And can even be used in people with anaphylaxis if you buy it in a high enough dose. And I have used that for people. I have used it in my office when people, even the injections I was giving them because of their reaction to the bee sting was not working, and I put that under their tongue and it finally stopped. Belladonna is for fevers. Belladonna, the plant, actually can be very dangerous, but the antidote is it stops a very dangerous fever-like reaction. Chamomilla is a wonderful tool for healing of wounds and abdominal pains, babies with colic, babies with painful teething, any sort of pain, chamomilla. And the list goes through and lists these out, and I brought that because I want you to walk away with something today. Rhus tox is specifically the one I talked to you about. It is the poison ivy, but it is also a vine, and so it's about wrenching your back. Rhus tox, if I lift something too heavy or I'm in the garden and I twisted it, one day of Rhus tox. I've never taken any Motrin or anything ever again. It's a wonderful tool. Calendula is my favorite topical treatment it is a natural antibiotic, and not only does it get away the bacteria and the infection, but it will help any abrasion or small cut to actually heal faster. So little kids who've scraped themselves or paper cuts that just sting and burn, I mean, it's amazing. And there's no allergic reaction like there can be with Neosporin or triple antibiotic ointments, and it is the best first aid cream you can have ever. I've had more people come in with wounds that weren't healing on oral antibiotics or topical Neosporin, and I said, go get the calendula, and it's gone in 3 days. It's wonderful stuff. And again, there is a whole list over there. One even includes the homeopathic sunscreen remedy. That's all my children get. No chemicals on their skin. It's wonderful. So again, why would you choose to use tools like this? Why have I pushed myself into this holistic practice? You know, the reason is that biochemical medicine, we are wonderful when it comes to trauma, where we have to go in and actually fix broken bones or head injury, that sort of thing. Biochemical medicine is wonderful at saving lives from life-threatening illness and infections, such as meningococcus, strep pneumonia, really clear-cut bacterial infections. But they're terrible when it comes to viruses. They're terrible when it comes to just acute emotional illness, not just severe depression. And with chronic conditions, it doesn't really cure, if you think about it. Acute infections, it cures. But biomedicine, allopathic medicine, alleviates suffering, and it does. But does it cure multiple sclerosis? Have you ever heard of a friend with lupus or rheumatoid arthritis that actually took the pills and got cured? No. And even diabetes. We try to teach people about diet and how they can cure their diabetes. 80% of them go on to take more medicines. 80%. It's not a very good number. It's not a very good track record for allopathic medicine. So I've learned to really try to look at that underlying cause. I was taught in allopathic medicine to do that. In medical school, I was trained to try to do that. But the reality is, in the fast-paced world of a 15-minute office visit, it doesn't help. The patients need more education. They need to understand how to actually make the changes and what their tools can be. And so ultimately, they come back and their numbers have gotten worse, and we say, oh, shame, let me put you on a pill now. That's been my experience for 18 years. So I really did want to congratulate you for being here today, because I know you had to really commit to your own wellness to make it on a Saturday to this presentation, to try to maybe just learn something new for yourselves. So it means you're motivated to keep yourself healthy in your life. But you can make other choices in what you're choosing every day to keep well, rather than wait till something happens. And if it happens, recognize the clues and look for answers and cure rather than just the diagnosis. Okay. So the one thing that I wanted to bring up to you was that the handout is there for you, and the homeopathic tools, I wanted to let you know that you can find them at every grocery store and pharmacy in this city. I'm not kidding. When I started to look at the over-the-counter remedies, just look, it'll say homeopathic ingredient for every viral, allergy. If it's over-the-counter, because it's safe, homeopathics have been very successful and people have been pulling them. And that list will help guide you to them. Some of my favorite tools with the winter coming up and coughs, Chestol honey. It's one of the best cough remedies you'll see. It's right in the cold care section. If you have a flu, like fever, overwhelming achiness, headache, cough, pay attention, because of course you could have that, or signs of some serious, but if your doctor tells you it's a virus, there's a remedy in CVS, Walgreens. It's called oscillococcinum, and so big word, it's on there, but it's listed. You'll see it in the cold care section, the flu remedy. It's a wonderful remedy. It's used all over Europe. It's the #1. If you have a virus with a fever, that's what I would use. There's a wonderful pharmacy here in town, if you're interested at all. It's called O'Brien's Holistic Pharmacy, where the pharmacists themselves are actually trained in homeopathy, and they can give you, if you have say poison ivy, they can tell you this dose, that's what you want to take. If you have cold sores, viral illnesses, they have lots of things and all over the counter, and you can just walk in and get them. And there are internet homeopathic pharmacies. So there's Washington Homeopathics, there's a few out of California, and so you can educate yourself on this and make your life easier and well, and have things at home and avoid even 1 or 2 more doctor's visits, and hopefully prednisone whenever possible. Well, thank you for listening and being here.